Every day, our environment is undergoing changes. Changes that impact and affect our world. Global warming, climate change, environmental pollution and degradation, desert encroachment and flooding are daily destroying our world and making it unsafe for habitation. How do we cope with these changes? How do we improve the quality of life through our environment? These and many more environment issues will occupy us weekly on Environment Today.
It's imperative that people comply with laid down environmental laws if we must enjoy the benefits of a clean and healthy environment. But there are certain habits which are outrightly unfriendly to the environment.
Join Nkoli Omodu every Saturday on Africa Independent Television AIT as we take an incisive and in-depth look at our environment. Environment Today, creating a better and safe environment for the world.
Welcome back. The non-passage of the National Tobacco Control Bill by the National Assembly since its introduction has remained worrisome to many concerned Nigerians, as the health implications of tobacco intake has continued to weigh heavily on both smokers and non-smokers alike. I did a special report on this to examine the delay, or if you like, the non-passage of the Tobacco Control Bill. Just take a listen. Tobacco use is said to be the cause of various ailments which have resulted in several deaths all over the world, especially in developing countries like Nigeria. World Health Organization's data puts rate of deaths from tobacco intake at nearly 6 million people each year, out of which 600,000 are non-smokers but die from breathing secondhand smoke. And unless something is done, and urgently too, the epidemic could kill more than 8 million people daily by 2030, particularly among people living in low and middle-income countries.
It is an addictive product, even though it's legal, and that's the argument of tobacco companies. It's a legal product, it's a legal product. Yes, it's a legal product, but then it kills people. You're addicted, a lot of people, and then people come up and say that it's a choice that you make. How many people started smoking at the age of 25? A lot of our people that started smoking at the age of 14 and 12, where they could not have been set to make informed choices because they didn't know what the constituents of a cigarette stick is. How does anyone in their right mind want to smoke ammonia? Ammonia is toilet cleaner. Carbon monoxide is gotten from car exhaust. Cadmium is found in car battery. Who in their right minds wants a cocktail of that in their system? So unfortunately, a lot of people didn't know what these constituents are. Tar is used to me. How do you sit down and look at the tar that you're driving on and decide that that's what I want to set fire on and inhale? So a lot of people before now didn't even know what the constituents and what it would do to their systems. All sorts. I mean, fine, a lot of people say the gestation period for a tobacco-related ailment is 20 years. But what about the smaller issues? What about the unfortunate people that, that are not smokers around you, but because somehow or the other, maybe they're your family, they're unfortunate to be your family members or your domestic staff or your staff at all, who don't smoke but who are unfortunately, at risk of a tobacco-related ailment.
The PAC say, the Ministry of Health says smokers are liable to die young. It is not like what you have in other climes in the developed world where you, in a pack of cigarettes, you see that this product will kill you. And for those who cannot read or write, for instance, who cannot read those kind of things on the packs, they see very, very deadly looking pictures which dissuades them from smoking. Abroad, you have pictures of aborted babies, damaged lungs, various cancers on those cigarette packs. So for those who cannot read or write, once they see those pictures, they are dissuaded from going ahead to take this. But then it is also, like I said earlier, on part of the tobacco industry ploy to replace a dying generation of smokers with the youths. And as such, you see so much of deceptive marketing strategy and what the tobacco industry calls self-censorship, but which we know are just deception.
Despite the staggering statistics, many young people are still deep in the act of smoking, and some into its cultivation in spite of global campaigns to discourage the habit. Sunday Adedeji works with Nigeria Tobacco Company (NTC), now known as British American Tobacco Nigeria (BATN), after its acquisition. He says pay is poor and no breaks, not even on weekends. Sunday and others like him who have now resorted to selling food grains say, besides the poor income from the business, the job is tedious and highly demanding, a position which contradicts that of the tobacco manufacturers who usually portray the farmers as prosperous.
They used to buy grade 1 at a rate of 250 naira per kg.
The lowest grade, how much do they buy it?
180. As we are planning this thing now, there's not any other market that we are going to sell this thing. Scout cannot come and be stopping us. But
okay.
When we plant maize now, they come and they take everything away.
At least about one stop and one stop. So that's I'm okay. So
a recent visit to some tobacco farms in Isheyin, Otu and Igbo-Ijaye communities in Oyo State exposed the activities and practices of the tobacco industry in Nigeria, mirroring the true state of local farmers.
The tobacco farmers are still in poverty, they are still in penury, they are still in a circle of slavery whereby the tobacco industry gives them loan, and the only reason, the only thing they can use to pay tobacco leaves. We shockingly discover what I can call fertilizer racketeering from a major tobacco company that is selling fertilizer at the rate of 7,100 as against federal government approved 5,600. And we think that it's high time now for the government to begin to look into tobacco farming in Nigeria. We need a baseline. How many farmers are involved? What are the kind of contrasts between the tobacco farmers and the tobacco industry? What is the percentage of leaves being cultivated in Nigeria and the percentage that is being imported?
To tobacco control advocates, only a speedy passage of the National Tobacco Control Bill, currently before the National Assembly, will address the plight of these farmers and protect Nigerians from the negative impact of tobacco consumption.
Each moment we fail to act to pass the comprehensive tobacco control bill in Nigeria, we are putting the lives of Nigerians on hold, including those that smokes directly and indirect smokers, known as passive smokers.
A lot more people have died because a legislation that will regulate the manufacture, smoking, the manufacture, production, distribution and sale and marketing of tobacco products is not in place. If that law was in place, it has several provisions. Provisions that will guarantee smoke-free public places, provisions that will guarantee that you cannot sell to minors, provisions that will guarantee that you do not engage in adverts or any other thing that will promote tobacco products. So we are urging the National Assembly to consider the packaged National Tobacco Control Bill, which has been forwarded to it by the Federal Executive Council, chaired by the President Goodluck Jonathan.
Though some states in Nigeria, including Lagos, have passed the no-smoking law restricting smoking in public places, a tough legislation at national level, backed with increase in taxes on tobacco products, can stop production companies in Nigeria from gambling with the lives of present and future generations through enticing adverts and promos, thus putting an end to needless deaths in the country.